Left on left forward sacral torsion. With a left on left forward sacral torsion, what's the dysfunctional base? Right. It's stuck forward and can't come back. And it's along what axis is this happening? Left oblique. Exactly. Guys, can't do anything to trick you guys at all. Impossible. All right. So on page 361, it's a left on left forward sacral torsion. Now, if it's a forward sacral torsion, and forward sacral torsions get better with lumbar extension because any forward sacral motion of the sacrum is going to be facilitated with what lumbar motion? Lumbar extension. They're already in that position. So what do you think? What big key element of lumbar spine motion is going to be important to do when we're correcting for the forward sacral torsion? Lumbar extension or lumbar flexion? Good. And if it's already rotating to the left and we want it to rotate right, we want the sacrum to rotate right. Which way do you think we have to make L5 rotate? To the left. So if you look in the position on page 361 in 1782, you'll see that that person is being flexed, and the way that their trunk is positioned on the table, they're rotating left. This position is called the Sims position. It's a very important position to learn when you're treating forward sacral torsions. And if we weren't treating a forward sacral torsion, but we still put the person in this position, what else could we maybe be treating? What else could we use this same position for to treat if we just went on the picture of 1782? ERS right. Exactly. An ERS right, because we're flexing and rotating and side bending the lumbar spine to the left. So this makes a fantastic alternative to treating an ERS right in this picture. But ERS lesions will do well with this, and forward sacral torsions will do well with this. Okay? So this is pretty straightforward. You're going to do this in the clinic more times than you think. And the way that we're going to do it is just like so. Let's try to zoom out.
Maybe two men manning the camera.
All right. So let me have somebody up here. Shivani? I'd like for you to lay on your stomach, please. Would you mind just removing the sweater? And your head will be at this end of the table. She might need a step stool to get up on the table. I said that because apparently you've been stealing them. Okay, what I want you to do is come towards me. The biggest thing when you're treating any sacral torsion dysfunction, you're always going to have to convince the patient that you're not going to let them fall off the table. You'll see what I mean in a few seconds. Now, what we want to do is we want to get Shivani into that Sims position. So the easiest way to get her to do that is I'll guide her through her iliac crest and ASIS while I at the same time ask her to bend up her knees. And we'll work together to get her into that position. Okay? So what I want you to do is I just want you to follow my lead with this. I'm going to guide your pelvis upward like this. You're going to stay with your chest to the table. Okay? So upward like this. And I'm going to ask you at the same time to bend your knees up, and I'm going to swoop them to the side. Okay? So on 3. 1, 2, 3. Oh. Come back down. Silly. Come on. It's Siobhan. All right, so here we go. 1, 2, 3. There you go. Good. Okay, great. Now, what I need to do is I need to be doing what? I need to be able to flex her to the point where I feel what? Where I feel motion at the lumbosacral junction, right?
Right.
Definitely. Because now what I want to do is be at the PSIS and monitor for that sacral base. Okay? So monitoring there. And what I've got going on here is I have her knees actually resting on the front of my thigh. So I'm working a little harder with this technique. The reason for that is because if you just let the legs rest on the table, they'll feel a little hesitant that they're going to fall. And also, when I start dropping the legs down into side bending for the gap, and I'll tell you why we're going to do the gap, sometimes that pressure along the IT band can be uncomfortable, especially if it's a sharp edge of the table, so you just want to be safeguarding against that. I'm just going to switch to this position. Good. Okay. So what I do is I monitor for the flexion, because I want to get lumbar flexion to occur to help the sacral base pop back. Okay? And she's already doing rotation of the lumbar spine to the left, which is forcing the sacral spine to rotate which way? So I can't really miss with this. The only thing left to have to explain is why I'm going to drop the legs down towards the table, towards the floor. Because I want to gap the area and allow that sacral base to rotate posteriorly into a posterior torsional motion to help correct for the dysfunction. Now, once I've localized to that barrier and I feel the motion occurring under my palpating hand, one finger can be on the sacral base. You can also be monitoring the lumbosacral junction if you like with the other finger. I ask for a very simple command of try to lift your feet towards the ceiling. Go ahead. And I resist her and relax. And I further side bend her. And I can also further flex her a little bit. So what she's trying to do with her legs, and I have your legs, I'll just show them, you won't fall. She's trying to lift them up like this. I'm blocking that through my contact with the feet and at the ankle. Okay? So lift again, hold, 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 4, 5, relax, 2, 3, further gapping, a little bit of flexion. Okay? And again, 1, 2, 3, 4, 5, relax, 2, 3, and further localization. All right? Good. Come back into the position. And now for reassessment, what can I do with her lumbar spine to check to see if the sacrum is now more posterior?
Bring her on her heels.
That's right. So come up onto your hands and knees. Sit back. And she's symmetric. Okay? Assuming the fact that she had a left-on-left backward sacral torsion. But she did really well. And she didn't fall off the table. Right? You thought you were going to for a second.
For a second, I really thought.
I told you, they all think they're going to fall off the table. So be very close to your patient when you're getting them into that position. I always tell them you'd have to fall through me to fall on the floor, and that's just not going to happen because you're right next to them. Okay? So let's get into the position to treat a left-on-left forward sacral torsion. Okay?